I'd like to welcome everyone and thank you for taking time to attend our first ever revisional surgery webinar that we are hosting here by myself. My name is Elli. I'm the CEO of Mexico Bariatric Center, MBC, and Dr. Christian Rodriguez Lopez from our Tijuana facility. We have a pleasure to have him as our guest speaker. You just, as you guys are joining, please make sure to be eligible to enter our $2,000 off of surgery raffle, that you do fill out a health questionnaire. If you have done it before, you don't need to redo it. Again, this is a webinar specifically for revisional surgery patients, post-bariatric patients. Of course, anybody who is attending, they're welcome. There is no harm of listening to this, but we would not enter you in the raffle, so you not be eligible. So if you have done the health questionnaire, you're good. If you haven't, please go ahead, go to mexicobariatriccenter.com and fill out the health questionnaire, and Dr. Rodriguez would be the surgeon of your choice. Toward the end of the webinar, I will be releasing the Zoom poll that you need to fill out. That's usually, before the Q&A session. And you can watch the webinar to the end, and we will do the raffle at the very end. We're expecting to be 1.5 hours, close to 2 hours. We'll try to do the best to answer all the Q&A, question and answers. We'll try to cover a lot of it during our presentation. So please, if you didn't hear the answer to your question, please go ahead and type it up and we would get to it. As far as the topics that we are going to cover today is basically the undesired outcomes of weight loss procedures. Then we're going to talk about, like, one of the common ones are insufficient weight or weight regain. We would talk about the weight loss options for post-bariatric patients. Our nutritionist actually is with me today. So it looks like we're still having a lot of people joining. So I'm going to go back and make sure that people who are joining now, wow. I'm gonna pause a little bit because it looks like more and more people are just joining, okay? Again, our people who just joining us, this is our first ever revisional surgery webinar. We have a pleasure to have Dr. Rodriguez from Tijuana join me. I'm in my office in Sacramento. And if you have not done a health questionnaire, please go ahead and do that. If you have, you don't need to resubmit it. At one point toward the end of the webinar, I will be releasing the Zoom poll, and you need to do that and watch the webinar to the end to be eligible to enter to our $2,000 off of surgery raffle. Again, this is just for people who have done a previous weight loss surgery and they want to go for a revision. Again, the topics that we're offering today, trying to cover is undesired post-bariatric procedures. One of the main ones are insufficient weight loss or weight regain. That's the most common one. We're going to talk about our weight loss options for those patients. We're going to have our nutritionist go over some options as far as nutrition is concerned. And then we're going to talk about what is bariatric surgery revision and what are the benefits. We show you some statistics of our past patients, what to expect. We talk about MBC, Mexico Bariatric Center, and we will talk about our new hospital that we just went live last Wednesday. About 10 days ago. And talk about our packages. A lot of you guys are past patients, so we don't need to talk about a lot of these things because you know how that works. And then Dr. Rodriguez takes over and he is going to talk about all the revisional surgery options that is out there and we offer. Then we talk about some of the medical tourism insurance financing. I will release the Zoom poll. At that time, we do the Q&A. And we will be doing the raffle. So let's talk about undesirable bariatric procedure outcomes. Okay, so one of the main ones, we will see the statistics soon, that it will be insufficient weight loss or weight regain. Or it could be complications like gastric band erosion, like Dr. Rodriguez said at the very beginning of our presentation. He just finished a band to a duodenal switch revision. A lot of the gastric band or lap bands ended up being a problematic, and it has to be removed or be converted to other procedures. We see that a lot. And other problems is maybe acid reflux, GERD, all that, okay? And, you know, again, people always talk about maybe gastric sleeve pouch stretching. Of course, it would never stretch to the size it was before, but it can stretch. The hormonal changes that can, over time, kick in, the ones that you acquired from the surgery, it may actually reverse. And nutritional deficiency, that's one of the problems that you can run into after surgery, or in very rare cases, insufficient weight loss. As a rule of thumb, the poor weight loss is influenced by genetics, age, comorbidities like diabetes, hypertension, depression, life events, we will go over that, preoperative BMI, diet, lifestyle, activity levels, and if you have had previous abdominal surgery, and the type of surgery you're getting. So these are all factors in weight loss after bariatric procedures. Again, we all know about BMI chart. Again, you plug in your weight, height, and it gives you a number that determines whether you're in the normal range, overweight, or obese, or morbidly obese. And it's kind of like a topic to touch base on is expected weight loss, right? So the chart on my right shows ideal weight for male or female based on their frame size, right? So BMI is a more generic number, but this chart shows you more like a specific for your sex, for your um, and for your size, whether you're small, medium, or large frame, and it shows you what would be your ideal weight. Now, when we talk about ideal weight, it's different from your goal weight, right? Everybody has a goal weight, but this chart shows your ideal weight. Doesn't necessarily have to match each other. You know, we all have some, like, say, if I weighed 140 pounds, I will look really good. So that may not coincide with this chart that I'm showing you. However, as a rule of thumb, again, your ideal weight you can find from here. And then what is your maximum or expected weight? Is basically for each procedure, we say a number. Oh, well, sleeve, you would lose 65 to 75 or 85% of your excess weight. So excess weight is basically your current weight minus your ideal weight, which you find from this chart, right? And then you multiply that by the type of surgery, expected weight loss, and that should be the weight that you should expect to have at the end of the procedure. If you're not, then we call it you have insufficient weight loss. Now, again, these numbers that you see in the literature, like, oh, gastric sleeve, you lose 65 to 75% or 85%, whatever, these are pretty much just the average numbers. If you look at the previous, if you pay attention to the previous slide I had, the expected weight loss is determined by so many factors, by your genetics, age, your lifestyle changes, your diet changes after bariatric surgery, so many comorbidities. So these are all playing a role. So also the type of surgery you get and how well that surgery fits you. And another thing is the surgeon that gives you the surgery, right? The surgeon that are more skilled, that are more experienced, they're going to give you better results. It's like not all the gastric sleeve surgeries are the same. They all named the same, but they're not the same. So these are all determining factors. We see in our patients that are very successful, and we will see later on the statistics of how successful our patients are. And that is due to the, first of all, we're giving them the right procedure. And second of all, our surgeons are the best in this area, in this field. We have the best bariatric surgeons ever. And they have experience, they are dedicated, they do their own surgery, they're not just a name to have on the website and then somebody else does the procedure. Okay, so much for that. Now we're going to talk about the factors that impacting the weight loss success, okay? Again, we talked about not having a healthy diet, not keeping up with physical activity, have a sedentary lifestyle, life events. That is more we see in the weight regain, right? So let's say you get to your goal weight or your ideal weight, and then we go through divorce, we go through losing our loved ones, right? Those are all affecting what the outcome is. Lack of sleep, these are little things, right? We talk about genetics, underlying medical issues like comorbidities, like diabetes. Then we're going to talk, so now we see what are the, if your undesired outcome is weight loss or weight regain, what are my options? Okay, so again, we always go to diet and exercise. Now, when we say diet, now you need nutritional support. And this is where our nutritionists are going to come online and tell you about the programs we have. And he's going to talk about things like pouch reset. These are the tools you have after bariatric surgery to get back on track and go back to your goal weight or ideal weight. So there is a new set of medication, drugs, which we know by Ozempic, GLP-1, semaglutide. These are the medications that are available that works good. Over 6 months, you can still lose weight. The problem is the cost, is the side effects, and it has to be taken indefinitely. So those are the drawback, right? And then is the bariatric surgery revisions. These are the options from ESG, gastric sleeve, arm-wide bypass, mini bypass, duodenal switch, so on and so forth. And we're going to go over them one by one. We talked about the success rate of bariatric surgery. You know, we have been in the business of bariatric surgery for over, well, I started myself in 2007, but I started Mexico Bariatric Center, MBC, in 2012. From 2012 to this date, we have 12 years of data, and we have done over 25,000 procedures. This is something that, because we have done so many successful surgeries, now I see all the other competitors, they're all claiming that they've done 5,000, 10,000, 20,000, but those are just numbers. We have actually performed that many surgeries between all of our surgeons. And the statistic shows that less than 5% of MBC patients return for a revisional surgery. Only, I think it was about 4%, but let's call it 5%. In the literature, if you read, they're talking about 15 to 30% of bariatric patients need revisional surgery. Okay, so let's see if Christian is online.
Hi, Ron, I'm here.
Hello, hi, how are you?
I'm good, how are you?
Yeah, great. So Christian is our nutritionist. He is very knowledgeable in this area, and he's been working very good with us. He does bi-weekly webinars for nutrition, and he just developed a program that we're going to offer soon, and he's going to talk about it, that we will be adding additional layer of nutritional support for patients, especially for patients who experience insufficient weight loss or weight regain. Okay, so I'm going to let him take over and talk about the plan he has.
Hi, everybody. Thank you all for joining. My name is Christian. Thank you, Ron, for the introduction. So our nutrition plan for people that book with us, we offer diet guidelines for pre-op and post-op. We offer bariatric vitamins and special packages. And we also do webinars. We do one webinar for pre-op and then one webinar for post-op. So you guys can join and watch and learn from the webinars, and then you can ask me questions at the end of it. And also, some of you might know me because I do call patients a week before the surgery and then 5 days after the surgery to go over the pre and post webinars. And this is our nutrition plan. And like Ron said, I'm excited to announce that sometimes next week we're going to launch the NBC Nutrition Support Plus. Ron, if you don't mind, going to the next slide. So it's an all-inclusive bariatric nutrition subscription. What's included, it's on-call nutrition support. We will have more live webinars and Q&As. Some webinars that we're going to offer is just general nutrition education, macronutrient education. I will teach you how to look for protein, carbohydrates, and fats. We also will have a webinar about the pouch reset that Ron mentioned. Well, I'll do pre-op and post-op guidelines, and also with this Nutrition Support Plus, I will give you meal plans. So it takes all the guesswork out of it. You can follow it. There's recipes there. I will offer food logs, shopping lists, checklists, recipes for the meal plan. We also will have a video library. We'll have a designated Facebook support group. And then also I can do personalized check-ins to go over any kind of questions that you might have or to help you keep on track. So it's a very, very valuable resource. And it's going to be only $79 per month. And if you join, like I said, I will work very closely with you. So we avoid some of the side effects that Ron was talking about earlier. And especially with weight gain or not enough weight loss, this would be a great tool to use. And like I said, I'll be with you every step of the way. I'll help you with everything that you need. And now I'm going to talk about the pouch resets. So the pouch resets are just a shorter version of the post-op diet. We have a 5-day one and a 10-day one. And this, it's ideal if you've hit a weight loss plateau, if you've regained weight, if your portions exceed 6 ounces because you don't want to stretch your stomach, you've stopped tracking food, or you want to regain control of your diet, or you're concerned that your pouch has stretched, like I said. The 5-day reset is 1 day of clear liquids, 1 day of thick liquids, day 3 is soft liquids, day 4 is firm solids, and then also day 5 is whole foods. So now it gives you a little bit of a path that you can follow to get back on track. And then the 10-day is pretty much the same. It's just a longer period. You'll have the first day clear liquids where you can have water, tea, broth. Day 2 and 3 would be thick liquids. And then day 4 and 5, soft solids. And day 6 through 10, it would be your long-term diet, and it will help you get on track. It will help you start refocusing. So it's a great tool to use. This is available already on our blog. So you can go visit our website, and all you have to do is search for the 5-day or a 10-day pouch reset. That was it for me. Thank you. Thank you, Ron.
Thank you so much. I appreciate you. So they will be hearing more from you when you have your program rolled out. Thank you. Again, part of that pyramid, you saw that semaglutide, GLP-1, Ozempic type of medications can help with getting back to your goal weight. But again, there are some pros and cons on this. First of all, as I mentioned, is financially is little hard because it's expensive and it's hard to get, as well as the side effects. Long term, you have to keep using it. Again, you know, we all know the difference between Ozempic and other bariatric procedures and bariatric procedures changes so many of your hormones, and these Mounjaro, Wegovy, Ozempic only changes so much of the hormones. But because you have that anatomical changes that already have had with bariatric procedure, that's going to help basically enhance those hormones, and hopefully you'll be back on track. So now we get to the gold standard, which is bariatric revision surgery. Basically, revisional surgeries, or we call them reoperation, conversion, and sometimes reversal, is basically correcting the undesired outcomes of the first or primary or the secondary procedure. And basically, it's correcting, modifying, altering, or reversing the previous procedure. Of course, the benefits of revisional surgery, it's going to help you to get back on track. Like I said, get to your goal or ideal weight, resolve comorbidities if you haven't like gone down all the way for insulin use or type 2 diabetes. Basically adds years to your life. And if you have had any complication, hopefully that would resolve it. And if you have had any nutritional deficiency or too much weight, losing too much weight, it will help you. Now, we promised to show you some of the statistics. So this is the statistics of our revisional surgery. Sleeve to bypass, about 30%. Band to sleeve, sleeve to mini bypass, RNY bypass revision, sleeve to duodenal switch, lap band to RNY. If you have had previous fundoplication, sleeve to SADI, sleeve to sleeve, which is re-sleeve. We do very limited of that. Dr. Rodriguez is going to touch base on that. Mini bypass to bypass, lap band to mini bypass, lap band ESG to VSG, which is the sleeve, and duodenal switch revision, and RNY bypass to duodenal switch. These are the percentage of the procedures we do. Again, the reasons for bariatric surgery revision, 74% of the time is insufficient weight loss or weight regain. That's why we touched base on that, right? That's the most reason the most patients are going through conversion, revision, reoperation. 14% of the time they have complication, and 12% of the time is a combination of weight problem and complications. This is the pie chart of weight loss after revision. We're going to see more of this data later on. As you see, more than 50% are losing 60 pounds or more. This is more of a detailed information about what expectations are. Now, again, this is statistics from our patients. This is not from the literature. If you go to the literature, you're not going to find the same. And you also have to remember that the second time or the third time you're getting the bariatric surgery is not as effective. It could be as effective as the first time. Sometimes it's not. So it's really in a gray area. But if you look at these statistics, they're very promising, right? This is a number that we gathered from our past patients. Look at that. Lap band to sleeve, 3 months, 29 pounds, 6 months, 42, and 1 year, 57. Lap band to RNY, in 1 year, 100 pounds. Sleeve to RNY, in 1 year, 79. Sleeve to mini bypass, 58. in 1 year. These are all 1 year. RNY bypass. This is really amazing to see these kind of numbers from, the bypass revision is the hardest one. And even that in 1 year, we see 50 pounds weight loss. Again, if you look at the percentage, again, we calculated how the excess weight loss, right? At the beginning, we knew the excess weight loss. So excess weight loss, as you see, it's pretty good. They're all about 50, 60, 70%, 84%. These are amazing numbers. And remember, in 1 year, you still, after 1 year, going to lose more weight. So this is just 1 year. The side effects that is coming with these procedures. Dehydration, vomiting, constipation, bloating, diarrhea, hair loss. Of course, the hair loss is most of the time is temporary, gas, and fatigue. These are the side effects, undesired side effects. This is the satisfaction of patients with gastric revisional surgery. As you see, over 50%, they have 5-star and very limited on patients that were not satisfied. This is the satisfaction with MBC. More than 4.2% of patients said they are satisfied with the surgery with us. Again, if you guys have done your first procedure or previous procedure somewhere else, I'm just going to touch base of who we are. MBC, we are a US-based corporation facilitator. Our main office is in Sacramento. That's where I'm actually presenting to you. And from the beginning, we have set standards for patients to go to Mexico and get bariatric and plastic procedures. Again, what are the pros and cons of going through the company like us? We're number 1 facilitator. And if you see, even CDC offers recommendation to select MBC for your journey. And again, I mentioned MBC has been in existence since 2012. We have had 25,000 plus successful surgeries. Right now, we have 5 teams of bariatric surgeons. These are individual teams. They're not just all of them one team. They have different names. They have their own assistant surgeon. They have their own instrumentation. They have their own nurses. They have their own anesthesiologists. And not only the surgeon is important, that team is important too. Especially the anesthesiologists. The most of the anesthesiologists we have, they are cardio anesthesiologists. They know so much more than just the regular inexperienced ones. So you have to remember all these features that you're getting with us. Why MBC? The best bariatric surgeons in business, 12 years in medical tourism. Look at our reviews on Google, social media. The care we're giving you, especially after opening our own center, you are getting VIP treatment. Now, why do you have to look into the surgeon now for your revision? Okay, we always say it's important to have experienced surgeon. We compared the experienced surgeon with the experienced pilot. You want to be flying with a pilot that has so many hours of flight time. The same that goes with the bariatric surgeons. Yes, most of the time it goes smooth, but then that one time your life could be at risk. And we've seen over and over. Now, this becomes even more of a point to research to get to a bariatric surgeon that are experienced. Why? Because they're going to give you what procedure they can offer, but is not good for you. Look at the variety, spectrum of the revisional surgeries we can offer. I saw recently one of the surgeons standalone is offering, trying to imitate us and offering revisional surgery. That surgeon is very limited of what procedure they can do. They can hardly do a bypass. They can do hardly a bypass of a BMI of more than 45, and that surgeon is offering you revisional surgery. You have to run. You will see today, once Dr. Rodriguez takes over, all the options that we're offering, what he can do, and what type of services you're getting from us. Then you will look nowhere else because you see the difference between what we do and what our competition does, or what these single standalone surgeons that can only limited to do a gastric sleeve on a low BMI patients. And they're offering you a revisional surgery webinar. It's really ironic. Why MBC? I mean, look at why MBC. The support you're getting from us before, after surgery, the Facebook groups, the staff that we have, layers and layers of people who have been working with us more than 10 years, our surgical teams. I mean, on and on. I can go on and on. We built Hospital Azar with a vision to redefine care for medical travelers seeking bariatrics and plastic services. Hospital Azar is built by the stringent national and international requirements. The rooms for patients are spacious with great views, modern equipment, and advanced technology for their comfort and safety. With 4 state-of-the-art operating rooms and ICU, we can serve routine procedures as well as complex surgeries to our patients. This premium facility is staffed by bilingual professionals who are trained to work with medical tourists. Our goal is to minister hospitality for patients who trust us and come from all over the globe for an enjoyable and comfortable experience during their stay. We are more than happy and privileged to be part of your healthcare needs. So now we're going to talk a little bit about Hospital Azar. So we had always this vision of having our own facility down in Tijuana. I started the project in 2021 with the best team of architects, with the best team of medical staff that helped me design and make this dream come true. And we named this hospital in my mom's name. And we were hoping that when we open the ceremony, she'll be down there. And she was not able to go down there because she was fighting with this monstrous cancer in her lungs. And she was actually in bed when we opened. We had the open ceremony. And as you see, she was witnessing the opening of the surgery with her CPAP on. And she lasted as long as we did the opening, and we just lost her last week, right after we opened the hospital. So this was an amazing experience, and we are hoping that this hospital will contribute to so many lives from here on. Again, this facility is a state-of-the-art and has 4 ORs, over 40 beds. All the rooms have views of 360. The technology, the experience is all considered to have the best for our patients going there. Again, we had the grand opening last week, and so this is pretty much, as you know, if you're our past patients, we have a very easy process. Our HQs, you submit, our surgeon's going to review it. Now it's even more important because it's for revisional surgery. You can even book your surgery online after you approved. And then once you're putting the deposit down, all you have to do is submit the paperwork, give us your flight or driving arrangement, and we will make sure you have a VIP treatment and seamless experience. This is a list of our revisional options. And I will, of course, I will have Dr. Rodriguez go over every one of them for you, but I'm just showing you what you're getting with us. You know, it's what we offer is unique worldwide. We get so many other surgeons, medical facilities coming to us to just observe what we're doing down in Tijuana. These are the list of all-inclusive packages for revisional surgeries. And of course, you know, we mentioned our support group. We have so many ways to support you, from our webinars on monthly to nutritional support, past patients. These are the past patients on our team: Sarita, Rena, Dawn, Kelly, Jamie, and we just hired another coordinator in Canada, Yvette. These are the ones that are helping our staff day to day, like Rena. She is actually a revisional surgery patient of us. And they do a podcast, again, for patients who came online later. If you have not done a health questionnaire, please go ahead and do so. Dr. Rodriguez is your surgeon of choice. I will release the Zoom poll before Q&A, and you watch the webinar until the end. We would enter you in the raffle. This is the best team of bariatric surgeons worldwide, as you see. Now, our process for approving your health questionnaire is even more important now, because you need to get exactly what you need. And that's why our surgeon liaison, our surgeon's expertise come into picture. You see how we handle every health questionnaire. We use Hyatt and Pueblo Amigo for our patients to relax pre-op, post-op. Again, you already know, if you're taking Ozempic, please stop 3 weeks before, stop blood thinners, no smoking, NSAIDs, and comply with the instructions of that surgeon liaison gives you, so you can have smooth procedure done. We want you to come before 12 p.m. and leave after 2 p.m. Again, we keep you in Hyatt or for pre-op, or your companion stays with you the first night and he stays in the hotel, have free breakfast included, and while you go through the procedure, we have right now 2 slots every day for visitation, which is 10 to 12 and 5 to 7. On the day of surgery, they tell you what time show up. You get picked up going to the surgery. So actually, if you are in a hospital, you can see Hyatt from our hospital, Azar. You could actually see the hotel is that close, is like 3 blocks. And this is the first batch of patients that are getting released. Now you're ready to go back home, and we take you across the border. One of our success rate has been surgeons' load management, which we limit our surgery per surgeon per day, depending on the complexity of the procedure. That's why our complication rates is less than 1%. That's another thing you want to look into that. In the published data, they're looking at 2.8% or more complication rate. We have less than 1% with all the difficult procedures that we do. Consider that. We're just not doing little sleeve and that's it. There we go. He's our super surgeon, Dr. Christian Rodriguez. He's a scholar. He's actually teaching other surgeons how to do surgeries, difficult surgeries. He was just in IFSO Congress. Prior to that, he was teaching a course in the Congress in Mazatlan. He is a skilled, experienced surgeon that we have actually honored to have in our team. There is not much I need to add more. He's going to take over. Dr. Rodriguez, we appreciate your time, and thank you so much for explaining to us all the revisional surgery options we have.
Thank you, Ron. And thank you everyone to be here in this webinar. And also a new notice I need to tell you is that in the next month, I'm gonna be, for the first time, I invited to be part of the teaching as a teacher in American Society of Bariatric Surgery. This is the biggest society, weight loss society in America, in the United States. So in the next months, I'm gonna be part of that team as a teacher. So that is something new I want to tell you. So what is revisional surgery? Revisional surgery, it is weight loss surgery is a tool to make everything easier to lose weight, to get back track in the diet, and also in the exercise and physical activity. And when we do revisional surgery, we want to give you a new tool or improve the tool that you already have. Okay, so that is the weight loss surgery and revisional surgery, because sometimes in this weight loss journey, we need to have a new tool or to redo that tool to get back to what we want to do on the habit. So after we already have a weight loss surgery, we have several options. Okay, if you have a gastric bypass, the first what we want to do is remove the lat band, because we know those bands can give us a lot of problems. They can give us acid reflux symptoms. So we need to remove that lat band, and we can convert to another revisional procedure. So the option that we have is gastric sleeve, wide gastric bypass, or mini bypass, and duodenal switch. Probably the best option after lat band, I will say it is the wide gastric bypass. But if your BMI is higher than 40 or 45, probably we need a powerful weight loss surgery that is gonna be the duodenal switch. So after lat band, also we can have a gastric sleeve if your BMI is around 30, 35, or sometimes 40. The gastric sleeve could be a good option. But the gold standard after a lat band, if your BMI is lower than 45, probably MRI gastric bypass is going to be the best option because it will improve the acid reflux symptom. And the gastric sleeve is the most popular weight loss surgery that we do right now. And we have several options. If you have weight regain, probably we need to think in a bigger tool that it is the MRI gastric bypass or the mini gastric bypass. If your BMI is higher than 40, 45, probably the best option is the most powerful tool that is the duodenal switch. If you're thinking in a re-sleeve, we can do that, but that's when you have to weight loss goal around 5 or 10 pounds because the results after a re-sleeve are not too good. So we need to tell you that. Sometimes the sleeve can get stretched, but the most important part is that, or to understand is we need to give you a different tool because you already have the sleeve. So that's why we recommend to convert to another weight loss procedure that is the MRI or duodenal switch. The endoscopic sleeve is something new. It's something that we do here in Mexico Bariatric Center, and that is a non-surgical option because we can get inside of the stomach and put some stitches to get back on that restriction. That is an option, but I must to tell you that the weight loss is not the same. Probably the best option to have long-term results that are gonna be the MRI gastric bypass or the duodenal switch. Patients that had a gastric bypass, that is something in surgery the gastric bypass has several steps. So to do a revision in gastric bypass is something difficult. That's why I believe in Mexico Bariatric Center, we have a lot of experience doing gastric bypass revision. And probably when patient did the bypass 10 years ago, when the gastric bypass was a little bit different than right now. Right now, the gastric bypass has several different steps from traditional gastric bypass. So what we want to do is to convert the traditional gastric bypass to a current gastric bypass that is a little bit more invasive and a little bit different. So that is the main goal to convert gastric bypass. But sometimes patients already have too many pounds to lose, and that's why we can convert to a different procedure. That's when we have the option of the duodenal switch. That is something really hard. Success, it will depend on findings during surgery, but that is an option. If your BMI is higher than 40 and you already have a gastric bypass, probably the duodenal switch could be a good option. And if you don't want surgery, you don't want to take the risk of the surgery, or your weight goal is only 5 to 15 pounds, we have the endoscopic option that is the TOR. When we reduce the anastomosis, the junction between the gastric pouch to the small bowel, normally size must be around 2 centimeters, but with the time it can get stretched. We can find 5 centimeters or 6 centimeters anastomosis, and we need to reduce that part of the gastric bypass. And we can do it with endoscopic procedures with no surgery. So that is a really good option. I like these procedures, but we can give you more restriction because we're gonna make it smaller. And also, but if you want to lose more than 20 pounds, probably we need to convert to a traditional gastric bypass or to convert to a duodenal switch. And the duodenal, so what are my options? Okay. If you have a gastric balloon is a reversal procedure. We need to remove the gastric balloon. We need to wait probably 1 month to touch to do surgery in the stomach, because we cannot do it at the same time or at the same moment of the gastric balloon removal, because it is too risky. So we need to wait to probably 1 month is going to be something safe, and we can convert to a gastric sleeve, or we can do it to airway gastric bypass, or meaning gastric bypass, or duodenal switch. Sometimes we patients wants to start with a not invasive procedure, a non-surgical procedure. We do a balloon. With the balloon, we can have weight loss around 10 pounds, sometimes 20 pounds, but sometimes patient needs more. So that's why when we remove the balloon and we do a weight loss procedure. Endoscopic revisional procedures. Patients that already have an endoscopic sleeve, that is a procedure that we only do it through the mouth. All the endoscopic procedures, the weight loss are around 5 to 15 or 20 pounds, okay? And if you want to lose more weight, we need to convert that endoscopic procedure to a laparoscopic procedure. So we need to do surgery. And we already have a big experience doing that. We know the steps that give you a safety procedure. And what we can do is do a gastric sleeve, or we can do an airway gastric bypass. Vertical banded gastroplasty revisions. Vertical banded gastroplasty was a procedure done probably 30 or 40 years ago. Right now, nobody do that kind of procedures, but we have patients that have that procedure and need an extra revisional surgery. The best option after a vertical banded gastroplasty is the MRY gastric bypass. But if you don't want to lose too much weight, we can offer you a gastric sleeve. But the gold standard for this revisional, it is the MRY gastric bypass. Okay, gastroplication revision. Gastroplications, it was a surgery done probably 15 years ago. We don't do gastroplications anymore. Probably nobody's doing this, but we can convert this kind of procedure to a gastric sleeve or MRY gastric bypass. Probably the best option is going to be the MRY gastric bypass. That is the gold standard for revisional surgery. Okay, so why you want to remove the gastric band? Probably the main reason that we remove the lat band is acid reflux symptoms, GERD symptoms. At the moment that when we place the lat band, the anatomy of the esophagus, the anatomy of the part that controls the acid reflux change, and that's why a lot of patients with lat band has acid reflux symptoms, and we need to remove. Okay, we need to remove the gastric band, and if you want to lose weight, we need to convert this procedure to gastric sleeve. If you have many acid reflux symptoms, the best option is going to be the MRY gastric bypass. And if you want to lose a lot of weight, probably more than 50 pounds or 60 pounds, the best option is going to be the duodenal switch. Okay, that is the most powerful weight loss procedure that we have right now. Revisional sleeve gastrectomy. The resleeve. Resleeve means that we only remove the stretched areas of the previous gastric sleeve. Okay. Anatomy. The stomach anatomy is the quality of the stomach can get stretched like a balloon. That is something that we cannot change about the tissue of the stomach. So sometimes we can remove the stretched areas of the previous gastric sleeve. Success is not the best after a resleeve. I must be honest with you. We can do it, but we want to give you the best option. That's why we didn't do much the resleeve. Sometimes when the patients did the gastric sleeve in another company or with another surgeon, if the sleeve is not make it as well as it must be, sometimes those patients can have benefits because we have a standard gastric sleeve, and if the surgeon did not did that procedure well, in those in those situations, the re-sleeve could be an option. But the best white blood results after gastric sleeve, probably we need to go to air wide gastric bypass or duodenal switch. Okay. Okay. The gastric bypass after gastric sleeve is also the gold standard because we can improve acid reflux symptoms. And also, we're gonna give you another tool. You already have a restriction tool, and we're gonna give you a malabsorption tool. So I believe it's one of the best options after a gastric sleeve because we can control GERD, and also we're gonna give you weight loss. Okay, and it is a metabolic surgery. If your BMI is lower than 45, sometimes probably the gastric bypass is gonna be the best option. This one is one of the most popular surgeries that we perform here in my team. So I believe it is one of the best options that we can offer to you. Gastric sleeve to duodenal switch. If your weight loss goal are higher than 50 pounds, 40 pounds after a gastric sleeve, we need to be the most aggressive as we can be, and that is the duodenal switch. Everybody's different. Everybody needs a different tools, and if you want a bigger tool, the duodenal switch could be an option, or it's gonna be the best option that we can offer you. And this one is the most metabolic surgery that we have in the world, the most bariatric, efficient bariatric surgery that we have in the world. So in Mexico Bariatric Center, we are experts doing this procedure. And after the gastric sleeve, if your BMI is higher than 45, probably the best options to improve your weight loss is gonna be the duodenal switch, okay? Something important in duodenal switch revisional surgery is supplementation is the most important part. That is something you must know. You must take your supplementations and your protein shakes, okay? The endoscopic sleeve. If you don't want surgery, this is gonna be the best option for you. The endoscopic sleeve, we can get inside of your stomach, do some stitches inside and make your stomach smaller. We can give you a lot of restriction, and I believe it's better than laparoscopic sleeve because it has lower risk and better weight loss results, okay? Weight loss results are not the same as conversion to gastric bypass or duodenal switch, but the most important part is it is not a surgery. It is an endoscopic procedure. And if your goal is around 15 pounds, probably this is gonna be the best option. And the most important is the risk of not having a surgery. Gastric bypass to gastric bypass. If you had a bypass 15 years ago, 20 years ago, you have acid reflux symptoms and you have weight regain, the gastric bypass, we need to do that traditional gastric bypass to convert a current gastric bypass that is more invasive. So we need to make, to redo all the parts of the gastric pouch. We need to reduce the size of the gastric pouch. We need to make the anastomosis smaller, and we need to give you more malabsorption and reconnecting the small bowel. So this is one of the most popular surgeries that we perform here in Mexico Bariatric Center also. And probably if you have a previous gastric bypass, it's gonna be the best option, or it's gonna be the surgical option for you, okay? If you don't want surgery, this is gonna be your option. You already have a gastric bypass and you don't want laparoscopic or the surgical risk, we can do the endoscopic procedure. That is something new that we have here in Mexico Bariatric Center. We get inside of the anastomosis, that is the junction between the gastric pouch and the small bowel. We do some stitches. We use argon plasma coagulation to make that stomach smaller, make it narrow, and to give you more restriction. Okay. There was a question about the dumping syndromes. This procedure can improve the dumping syndromes, that is nausea, vomiting, or hypoglycemia after carbohydrates meals. So this could be an option to improve those dumping syndromes and give you more to have more weight loss. Okay. The gastric bypass to duodenal switch is one of the most difficult surgeries that we perform here in the company. And we want to do is do a new procedure, is convert the gastric bypass and make it to a duodenal switch. This procedure is designed for high BMI patients or patients that the weight loss goal is around more than 40 pounds. Okay, this is one of the most powerful procedures that we can do, and we can do it. We have a lot of experience doing this procedure. Probably we are one of the teams that we have more experience in the world. So this could be an option. Results or success, it will depend on findings. But if your goal is to lose more than 40 or 50 pounds, probably we need to convert to a duodenal switch. Mini gastric bypass to air and white gastric bypass. Mini gastric bypass is the one anastomosis gastric bypass, and one of the problems that you can have with mini gastric bypass are acid reflux, and the only way to improve this is to convert to air and white gastric bypass. Okay, to convert to a traditional bypass. So if you have a mini gastric bypass and you have acid reflux symptoms, the best option is gonna be the air and white gastric bypass conversion. Duodenal switch. Okay, duodenal switch revision are designed when the duodenal switch was too much, because it is really a real powerful surgery. If you're losing too much weight probably after 5 years with the duodenal switch, and you don't want to lose more weight, we need to convert to air and white gastric bypass. That is not something that we do really often, but if you already have a duodenal switch and you don't have those, you don't want to lose more weight, this is gonna be your option. Okay, it's like a reversal of the weight loss surgery. And the gastric balloon. If you have a balloon or you already have a balloon, we can remove the balloon and make a conversion to all the procedures that we already mentioned to you. Gastric balloon are not the best options to long-term results. So we need to remove the balloon, wait probably 1 month to do a safety surgery, and that is the option that we can offer to you.
Well, thank you so much.
You're welcome.
I was reading one of the comments that they said, well, you guys are offering so many different options. Which one is best for me? That's where it comes to the system that we have, right? The surgeon liaison, the surgeon itself, of course. Our coordinator is going to help you pick the best option for you. And this is what you get coming with MBC, rather than going to other centers or other individual surgeons, which they are very limited what they can do. So all they offer you is probably sleeve to bypass. And that they can't even do that, I know. I've been in this business from 2007, I started traveling to Mexico to all different centers in Cancun, Monterrey, Guadalajara. I know the facilities, I know the surgeons. These surgeons are handpicked that working with us, and that's what you're getting. By the way, I released the Zoom poll, so please go ahead and answer that while we're still covering the last bit of our presentation before we get to Q&A. Dr. Rodriguez answered a lot of the question and answers, but still there are some left we will go over. So basically, you know, if you need financing, these are the options. Best egg, we see a lot. Your bank, if you have good relationship, your credit unions. Now, another benefit coming with us, you get a discounted, of course, optional, but what we call MTI, medical tourism insurance. This would cover the complication, undesired treatment results, or any disruption because of complication. I highly recommend you take advantage of this, especially for the revisional. They asked, one of the questions was, is the risk is higher? Of course, this is the second time. A lot of the surgeons in United States don't even want to do any of these revisional surgeries. They don't want to touch it. And if you look at now the numbers, we have less than 1% complications. Consider the type of surgeries we do, look at the complication rates we have. That's even more significant now to see how low our complication rate is. But definitely you guys need to buy MTI. Again, Christian went over our bariatric vitamin program, emergebariatrics.com. It comes in different formats. Again, once you're getting bypass and DS and all that, you really need to take these vitamins. Okay, so I'm still waiting for everybody to answer the Zoom poll. So I'm going to give you a little bit more time. Yes, please make sure that you are participating in the webinar poll, because that is the requirement to enter to our $2,000 off of raffle. So Marcelo is asking, what's the average weight loss for revision from RNY to DS? Again, if you looked at the chart that we had, these are all over 50%, 60% of excess weight loss. Okay, this webinar, it will be available online. If you can't get a hold of it, just contact us, contact your coordinator and get a link. Thank you for so every time they do a revisional surgery, they have to deal with scar tissues from the previous surgery. And that is one of the challenges. Okay, I'm going to back up for financing. There you go. We don't have in-house financing. So your best bet is, again, if you have a good relationship with your bank, or credit unions, Best Egg, like I said, we see a lot of them coming from there. You basically SoFi. We don't have our surgeon available so you can talk to Dina. We can arrange for that, but you have to go through the coordinator to set up that one-on-one. But again, we thoroughly review your HQ, and you have a chance to still talk to the surgeon when you go there. So it's not like if we book you for some procedure, you go there and we're going to blindly give you what we said here. You're going to have a chance to talk to the surgeon and make sure that's the right procedure. And we can always change what is best for you the last moment. Yes, your insurance in US is not going to cover a complication there. So Christian is going to talk about this nutritional program next week. He's going to release it next week. You will have more details. Just stay tuned. No, the webinar poll is about, I think, let me see, about five questions. Yeah, six actually, 6, 7. Oh, actually, yeah, I'm sorry. 8 questions is on the webinar. Make sure you answer them all. I am almost done with the, these are the success rate stories of patients with the revision. Okay, so again, when you read these statistics, it depends on, oh, Justin is another success story. Look at him. I remember when he first time he had surgery, and honestly, I know this guy like my own son, Justin. Yeah, I mean, the success rate we get with the first surgery in this, remember, only fraction of our patients go through revisional, and you see that coming from other companies. And it's amazing that if you have done it HQ and I cannot resubmit the poll because if I do, then the results of the first one goes away. You should have seen it in your Zoom popping up. So gastric sleeve is not reversible. You can convert it to other surgeries, but you cannot reverse it. Okay, Travis, did you call 855-768-7247? And remember, our coordinators are off today. They come back Monday, 7 a.m. Pacific time. We do have after hours. Sarita usually answer those, but you can try that. But if you really want to talk to your coordinator, you need to start calling us on Monday at 7 a.m. Okay, so when you talking about, that's a good question, Jason. For the revisional procedure, sometimes they do need to perform an endoscopy. And these are all included in the price. We're not diamond nickeling you. When we charge you for revisional surgery, this is all inclusive. We're not going to come back and say, pay $450 now for the endoscopy, because it's just a part of the package, okay? So Travis, if you listen to Dr. Rodriguez, for gastric sleeve, you have several options. You can go to bypass, mini bypass, DS, SADI or BPD DS. These are your options. Now, remember, everybody is talking about the pouch stretching and all that. Yes, those are factors, but remember, a lot of the effects of bariatric surgery is hormonal. So over time, the hormonal balances change and you may not get the same results. So, but with diet, proper diet, staying active, lifestyle changes, that's the tool you're receiving. So with those changes, you can always stay in shape. So just give me one moment here. As you guys are finishing the Zoom poll, I am working on starting the raffle so we can get the raffle done, and we'll be about 1.5 hours. So I'm going to back to sleep. So these are the options. For sleeve revision, you can do re-sleeve, bypass, mini bypass, TS, BPD, DS, or SETI, and endoscopics. Looks like a lot of people did all that. I'm just waiting for the last ones to come in. And again, I appreciate everyone to participate. As you see, from the type of procedures we offer, from the hospital that you guys are going to be in, Hospital Azar, there is no other place to look into. For your first procedure or revisional procedure conversion, this is the one-stop shop. We can get you all that you need. We don't force you to get what we can offer. You'll be getting what exactly is best for you. So we have the name of the winner of the $2,000 off raffle. And let me make sure I say her name correct. Sameh Melika. Sameh Melika. I'm going to let you talk, and please unmute yourself. So first of all, congratulations. And
Thank you.
can you tell your name so we don't...
Samah Malaika.
Sameh Melika. Okay. Where are you from?
I live now in United States, Kentucky State.
Okay.
I originally from Egypt.
Oh, okay. Okay. So do you want to tell us about your weight loss journey?
Yeah, I had surgery on 2017, March
Wow.
2017, and I used to have, I think my weight was 184 pound. Now I'm I went down to 120. But and recent, like 3 months ago, crave the food is been increased. So now I'm in 140. 140 pound.
Okay, well, great. I congratulate you and
Thank you
please,
so much.
yeah, sure. Thank you everyone for attending. We would definitely have more of our revisional webinars coming. We have a lot of specialized now webinars beside our regular webinar, and our coordinator is going to be in contact with you to make sure you're being taken care of. Okay, thank you so much. I appreciate Dr. Rodriguez. He had to run back to perform rest of his surgeries for today, and we would see you guys soon. Thank you so much. Bye-bye.